Please take a short pre-episode survey in the description before listening to today's episode. Thank you and enjoy the show. Welcome to today's episode of Rarely Understood, where we explore important topics in healthcare and science. I'm your host, Nini Gamu, and today we're diving back into a condition that affects many families but is often underdiscussed, Duchenne Muscular Dystrophy, also known as DMD. We're joined once again by Leah to continue our conversation from the last episode. Leah, thank you for being here. To start us off, do you have any advice or words of encouragement you'd like to share with families or caregivers who are navigating a Duchenne diagnosis?
The advice I would give first and foremost is to connect with your community. Find the people who are also living with Duchenne in their lives. Reach out to them for moral support, for any and all support, actually. Let them help you navigate insurance, navigate, the home remodeling that you're going to have to do, how to get a vehicle that can actually fit a wheelchair, how to have a lift installed into that vehicle, and then just also hearing their experience over time, and the progression of their son through this disease and how that was navigated. And just, you need that support, especially if you're unfamiliar with Duchenne and you just sort of get this diagnosis and you're in shock and you don't know what it is and you don't know what to do. Just reach out, and there's so many wonderful patient groups that exist now internationally, but in the U.S., there's Parent Project Muscular Dystrophy, there's the Muscular Dystrophy Association, the MDA. They have so many resources for connecting you with families who are going through the same thing as you. They have a lot of resources for free genetic testing for family members. So, for us, for instance, with my brother being the first one in our family to ever be diagnosed, we didn't know who was a carrier. And so it could have been my mom, it could have been my mom's mom, it could be my mom's sisters. And if my mom's sisters were also carriers, it could be their daughters and things like that. So it's sort of a wide sweeping possibilities there. And so having a resource where you can get free genetic testing for all of those people in your family is just so necessary. And it's something that my mom and I didn't have. We didn't know about it. And PPMD sort of wasn't doing that at the time when we were trying to figure out our diagnosis. And so that's super helpful. So that's the first advice I would give. And then in terms of words of encouragement, I think just speaking to these boys who are living with Duchenne is just amazing. You will leave the conversation just feeling so uplifted, and because they have such a wonderful outlook on life, even though technically, they could just be completely depressed about what has been given to them and all the struggles that they have to deal with daily. But every single one of them I've ever met just have this beautiful outlook on life. And I think that's all the encouragement you really need, is just hearing them and listening to them as they navigate their world. And then the other words of encouragement from someone who's lived it is just look at how far we've come in, just 15 years. We now have FDA approved genetic therapies, which aren't perfect, but it's a baseline. We're getting there. We're having just the first therapy itself FDA approved just gives us a stepping stone to continue forward and continue optimizing these and having an avenue for FDA approval. And the FDA has been actually now speaking to families and hearing from people who have these rare diseases and things like that, and they're changing some of their protocols and some of the way that they go about approving a new therapy for a rare disease. They're changing some clinical trial requirements, for instance, there's a big push where to get a therapy approved at the FDA for Duchenne meant that the person with Duchenne still needed to be able to walk, because they had to do this 6-minute walk test. And that was like sort of the gold standard of how they determined whether a treatment was working or not. And that just excludes everyone that's already in a wheelchair. And so there's been a big push by patient advocates themselves to be included in clinical trials and for them to come up with a different way to determine if something's working or not while they're still in a wheelchair. And so, like, I think a lot of groups and clinical trials have been sort of opting in for, like, raising your arm a certain height and leaving it up for a certain amount of time and things like that. So they're starting to evolve and listen to patients and listen to families and what's important to them, which is just so encouraging. And that was not happening before. So I think there's only light at the end of the tunnel at this point. We're going to keep moving forward. We're going to keep pushing. And now we have all these stepping stones and building blocks to build off of, and we're going to get there. So I think that's very, very encouraging in my mind.
That's very insightful advice. Thank you for sharing that. Early detection can make a big difference in both care and long-term outcomes. Could you tell us a bit about the current methods available for prenatal and newborn screening for Duchenne?
Yes, so I went through these myself, being a carrier. So I'm well versed in all the things. So in terms of prenatal screening, of course, this is coming from a place where I have a family history. So I knew, and I also had my genetic test results. I knew I was a carrier. So it's a little different for people who know they're carriers or might be carriers because they have a family history, versus people who have no family history of it at all. So I'll start from the perspective of people who know they have a family history and might know that they're a carrier. So for prenatal screening, there's several options. One of the options I was most excited about and thrilled about that it was finally available when I was pregnant is and I'm not exactly sure the name of it, but it's a blood test, and it could be so very early on, like 6 weeks in, which is super early. And it's based off of a phenomenon where when you're pregnant, fetal DNA is actually like it's degraded and it's kind of chopped up, but it does end up circulating in maternal blood. And this was discovered, I don't know how long ago, but pretty recently, that you can actually take a sample of the mother's blood and sequence fetal DNA from it, which is amazing. And so the reason that's amazing for Duchenne is that you can sequence the fetal DNA to see if there's a mutation in Duchenne, but you would need to know exactly what mutation you're looking for. You would need a large volume of blood, and you still may or may not be able to figure that out. But what you can figure out pretty easily is the gender. And so you can figure out if you have a male or a female fetus, which is very important for Duchenne, because we know if you have a male, then you know they have a 50% chance of having Duchenne. If they're a female, you know they have a 50% chance of being just fine or being a carrier. And so that was super important. So immediately, when we found out we were pregnant, we had that done. And we were able to find out at 7 weeks that we were having a girl. And it was just thrilling because normally, like back when, let's say, my mother was pregnant or something like that, you had to wait till you were 20 weeks along to get the ultrasound where you're looking at you're looking at the genitals and trying to figure out if they're a male or female. And so that, in my mind, that was too late. And I want to know early on so I can help make informed decisions about my pregnancy at that time. Or the earlier, the better. And so I was so thrilled to have that option. And so we still did some more testing after that just to sort of confirm, because it is super early and there can be false positives, false negatives, that kind of thing. And so the other prenatal screening that's available is CVS sampling. So that's chorionic villus sampling. It has to do with part of the placenta that they can go in and take a small sample of that and do genetic testing on that. So then they can figure out, is there this mutation or not? So if you know that you're a carrier, you have the family history, and you actually know where the mutation is, that's very helpful, because then they know exactly where to look with that sampling. If you are just a person who doesn't have the family history and you just want to know, if you're you might be a carrier, if your fetus might be affected by Duchenne, you can do CVS sampling. They'll just look for what's called hotspot mutations. So this is sort of like what they do for any person who has no family history but just sort of wants to know. And hotspot mutation is really where they're looking for big deletions or insertions in the gene, or these mutations that they know end up affecting a large percentage of fetuses that end up getting Duchenne. So for me, actually, for our mutation, that wouldn't have worked because I don't have a hotspot mutation. I have a one single base pair mutation. So if I had done that, not knowing if I was a carrier or not, they would have missed it. But it's at least something. I think in about, I'm not sure exactly on the numbers, but I think in about 40 to 50% of all cases of Duchenne, they result from these hotspot mutations. So you will pick up at least like 40, 50% of people by doing that. But it is better to know your exact mutation so that people can know exactly where to look. But that's another test you can do prenatally. Relatively safe. It does come with, some risk of spontaneous abortion, but it's no bigger of a risk than the amniocentesis, which is a little bit later on. So the CVS sampling can be done as early as 10 weeks. If you Google it, you'll see like 12 to 14 weeks. But if you actually are speaking with someone who's very familiar with Duchenne and things like that, you can actually get them to test a little bit earlier. So 10 weeks, that's still pretty early. And then the other prenatal screening you can do is amniocentesis, which is around like 16 weeks. So I ended up not doing the CVS sampling. I did the amniocentesis, but that's where they take the big needle and take some amniotic fluid out, and they can sequence fetal DNA from that. And that's how we found out my daughter is also a carrier. So we knew then at 16, well, you get it done at 16 weeks, and then you have to wait 2 weeks or so for the actual results to come in. But that's another way that you can do it. So all in all, you can pretty much have an idea by the time you're 20 weeks, which isn't ideal, but it does, give you some time to make some, informed decisions on what you want to do and how you want to carry forward with your pregnancy. So that was really nice. And then with newborn screening, it's very interesting. I was looking this up because I didn't know, and I just sort of figured that this was happening, but it turns out it's not. So newborn screening is something that is done. It is controlled by the Department of Health in each different state, and they determine what goes on their newborn screening panel. So when you have a child in the hospital, they'll come around, they'll prick the child's heel, they'll get a blood sample, and that's what they're doing, is they're doing this newborn screening panel according to the state. And the states pretty much determine what goes on the newborn screening panel amongst themselves based on things like how severe a genetic disease might be, how important it is for early detection, and if it's treatable or not. And people always have the option to opt out of it if they want to. Like, the hospital is going to ask you if you want to opt out or not. And so they have a big panel of lots of, I think like Maryland has like 60 something diseases that they look for. Other states like Virginia, I think, only has 30. So it's very, very heterogeneous across the United States on what's on there. Patient groups for Duchenne have been advocating for adding Duchenne muscular dystrophy to the newborn screening panel for years and years and years, because we know that even though it's not quote unquote treatable or curable, it's better to know as early as you possibly can to not only prepare yourself mentally, financially, all the things that you need to do, but also it's important for these children to start their steroid treatment at between 3 and 5. And usually they don't start showing symptoms until they're 4 or 5 years old. Also important for clinical trials, especially for clinical trials where we're trying to modify the actual gene, the mutation in the gene with CRISPR and so forth. The earlier, the better. The earlier we can enroll these children, the better for them, because you don't want damage to already be present by the time you're trying to fix the genetic problem, because you can't reverse that damage. And so the earlier, the better. So it'd be a great idea for all the states to adopt having at least the hotspot mutations. Again, you're not going to catch everybody, but you can catch a large majority of the cases if you had it on newborn screening panels. So I know patient groups have been advocating for this, and I looked it up, and there's only 2 states that currently have it. I think it's Minnesota and Ohio that currently do it. New York adopted it, but they haven't implemented it yet. Same with Massachusetts. And then I think California and Georgia are putting it through legislation now, so it might end up on their screening panels. But that's it across the entire United States. So I would love to see that become a bigger push, because again, the earlier we know, the better. But I think the pushback from a lot of states is that there's not a treatment and there's not a cure, and that's a big reason for putting a disease on a panel or not. But if you're a parent and you're concerned, you can you'd have to pay out of pocket for a lab to do it, but you could get it done yourself. But a lot of people don't have the financial means to be able to do that. So it would be nice if it was included on these newborn screening panels. I think that would really help. But yeah, that's kind of what's available now. And again, if you have a child, they really don't start having symptoms until between 3 and 5 years old. And from there, then you're going through the diagnosis and you're going through all the things. So it's better to know from the start so that you can connect with other families, learn from them, maybe switch your health insurance so that you can make sure that not only potential treatments will be available for your child, but also you want to find the clinicians who are well versed in Duchenne. And there's not a whole lot of them in the whole United States. And there's some treatment centers that are sort of sanctioned treatment centers all over the U.S. Maybe you want to move. Maybe you want to get live near one of these sanctioned treatment centers, and you want to make sure you have a doctor who's well versed in Duchenne and knows all the nuances and all the treatments and all the clinical trials that your child might be able to enroll in to help them and all the things. You want to have all this information, and you want to be on the ready so that you can give your child the best life possible with this horrible disease. And so I think, knowing the earlier you know, the better for everyone involved.
Wow. It's incredible to see how both screening and science are moving forward together. Before we wrap up, Leah, do you have any final thoughts or messages you'd like to share with our listeners?
No, thank you so much for the invitation. I'm thrilled to be able to speak with you and share some of my personal experience and some of my scientific knowledge, although I am not an expert. I will admit that I'm not a neuromuscular researcher or doctor, but just my lived experience. I'm so happy to be able to share it. So thank you very much.
Thank you, Leah, for taking the time to share your insight and experience. It's been a real honor having you on my show. And thank you to our listeners for tuning in to today's episode of Rarely Understood. Be sure to check out the episode description for helpful resources, and please take the short post-episode survey too. Your feedback helps us grow. Until next time, take care.